Hi, it's Dr. Smith again. In my last video, we talked about why taking antacids or proton pump inhibitors like Nexium, Prilosec, or Prevacid may not be the healthiest way to handle symptoms of GERD, reflux, or heartburn. Now, to find a more natural, healthier way to improve this situation, we need to look at how the stomach actually works. So let's take a look at the stomach. You can see by that drawing, you can understand why I'm a chiropractic physician and a certified nutrition specialist, not an artist. But let's say this is our esophagus, or the pipe that the food travels down from our mouth to the stomach, and here's the stomach. Now, when you eat food and start to chew, actually, and as you swallow, your stomach produces, and the parietal cells in the stomach produce an acid called hydrochloric acid. This is a very strong acid, and when you have more acid, the pH of your stomach begins to lower. And that's very key. The pH in the stomach needs to get low, or lower than it was before you had the food. Because when you eat the food, there's a sphincter here, almost kind of like what you think of as a valve, a sphincter, that when we chew and swallow, that sphincter opens up and allows the food to get down into our stomach. Now, when the food hits the stomach, the acid is released, more acid and more acid gets produced until we get to the optimum level. When we hit the optimum level and the pH gets to the right level, this sphincter will once again close. It stays open until you get the right amount of stomach acid, and then it will close, and food or acid can no longer get back up into the esophagus. If you do not have enough acid, this doesn't close. When this sphincter doesn't close, the HCl, hydrochloric acid, can get back up into your esophagus, and that's what you have when you have reflux or heartburn. It's because you don't have enough acid that this sphincter doesn't close, and when it doesn't close, that's where the problem begins. Now think about that. I know it's counterintuitive, but the key is if you do not have enough stomach acid, the pH doesn't drop, the sphincter doesn't close. When it doesn't close, it allows food or acid back up, and that's what causes the burning and the heartburn. Now see what happens when you take medication? It lowers the amount of acid your stomach is producing. And it lowers it so much that there's not enough to escape back up into the esophagus, even though the sphincter didn't close. That helps your symptoms, but it screws up your digestion. You're not going to have enough acid to digest protein, absorb magnesium and calcium and other minerals, or to absorb vitamin B12. So, I know it's counterintuitive, but the natural way to fix this problem, or at least address these symptoms, is to take more HCl. See, you can take a substance called betaine HCl, spelled BETAINE HCl. That's betaine hydrochloric acid. You can also take apple cider vinegar. You want to take these after a meal. When you take it right after you eat, it's going to increase the acid in your stomach. And when you increase the acid in your stomach, not only is your digestion going to be better, but it's going to allow this sphincter to close. When it closes, the acid will not be able to escape into your esophagus and cause heartburn or GERD. So you're going to have fewer symptoms, no symptoms in most of my patients that I've tried this with or recommended it to. your digestion's going to be better. You're going to digest more proteins. You're going to absorb more calcium, magnesium. You're going to absorb more vitamin B12. Now, betaine HCl or apple cider vinegar, you can find it very inexpensively in most health food stores, vitamin stores like GNC or the Vitamin Shop. You can even find it in a lot of grocery stores. They're not expensive, and when taken properly, they have no dangerous side effects when you take the right amount and when you take them at the right time. My only caution is that if you have an ulcer, you want to avoid this until your ulcer is healed. Now, in my next video, we're going to discuss why you may not be producing enough stomach acid in the first place and what you can do about it.